you're going to have a lot of people, especially like transplant coordinators, nurses, doctors, that are going to try to marginalize the events that are taking place in your life, right? They're going to try. A transplant coordinator's job is literally to make you feel like this is not a big deal and that you're over exaggerating. But that's bullshit. What's happening to you is real, and it does matter, and it is important. You are undergoing life changing events. Your life, my life, as somebody who's suffering from end stage renal disease, will never be the same. Even if I get a transplant, my life will never be the same again. I will be on a litany of different drugs for the rest of my life, or as long as the kidney will last. And there's no guarantee that a transplant is going to last forever. You have some people that think it's just a one and done. No, it doesn't work that way. A kidney could last you 20 years, or it could last you 6 months, or it could last you 5 years, or it could last you 10 years. There's no way of determining how long a kidney transplant will last. But that's what I'm shooting for. That's what I'm trying to do. And you talk to these coordinators, and it's their job to try to make it seem like, oh, well, this is really not that important. Oh, well, it's not that bad. Oh, you've been on the transplant list since you were like 36, and you're almost 40 now, and you're still waiting for a transplant. Oh, well, 40's not that old. You know, like, you still have your whole life ahead of you. It's literally their job to, like, feed you this idea. Like, and meanwhile, you're just waiting. You're just waiting for something to come through, for something to happen. And these are just my opinions, but they say that there's a shortage of kidneys. I don't believe that. I don't believe that. Oh, well, you know, we can't just give you a kidney because there's just no kidneys to give. We just no kidneys to give you. We just don't have them. Where's the kidney shortage? I don't believe that. I believe that if you are a certain type of person, they will move heaven and earth to make sure that you get a transplant. Top notch, top shelf kidney transplant. And I've said this before in videos, and a lot of times, like, they don't care. These transplant coordinators, you know, these nurses, these social workers at these transplant centers, they just don't care. You know, it's your life, it's your time, and it's just ticking down. And I don't want to hear this bullshit about how, well, life is what you make it. They'll tell you that too. Well, life is just what you make it. Life is as good or bad as what you make it. Shut up with that bullshit. They know exactly what I mean when I say my time is being wasted. So some of my logic for wanting a kidney transplant so urgently is that the sooner I get a transplant, the younger I get it, the easier it will be for me to bounce back, to go back into the workforce. So that way, my recovery time won't be as long, it won't be as bad. Because the older I get, the more challenging it's going to be on me as far as the surgery and the healing process and possible infections. So for me, it's not fun for me to just sit around just hoping for the best and just waiting for a transplant. Like, I need things to happen. And before anybody says anything, listen, I know that things don't happen on my time. And I get that. But for me, for myself, even if the transplant coordinators don't give a shit about what happens to me, and a lot of times when you talk to them, they'll give you these sterile, emotionless answers, and a lot of times they don't care. But for me, I cannot allow myself to get stagnant and get complacent, because that's what they want you. Mentally, that's where they want you. They want you to get nice and docile and complacent and not rock the boat. So that way, if they feel like keeping you on the transplant list for the next 15 years, well, he's not going to complain. Look at how happy he is. He took every bit of advice we gave him. He found happiness himself. He found the silver lining on every cloud. He found the happiness in the tragedy. He went out and he did that. So now we could just drag our feet and take our sweet ass time with every other patient now. Because if we can get every patient to just think like he does, then we don't have to do our job. And now I'm speaking from my personal experience here. What this does is this crushes your hope. It crushes my hope. I don't believe in any aspect of this. From the coordinator to the social worker to the nurse I don't believe in any of this. But that does not mean that I do not want a kidney. I want a transplant. I want a kidney transplant worse than anything. More than I've wanted anything in my life, I want this to happen. But because of the way the system is, it's always going to be an uphill. You're always going to be fighting upstream. Unless you're a kind of person that they like. This is why it's so important for transplant patients to voice their opinions. Don't just roll over and just acquiesce or just kiss their ass and tell them what they want to hear to get your kidney. Because rising tides raises all boats. And for every single patient that just quietly and politely just waits their turn, that's telling them that they don't have to do their job. That's telling UC Davis. That's telling CPMC. That's telling UCSF. That's telling UNOS. That's telling OPTN. That's telling all of them they don't have to do their job. You are not important to them. Well, they don't care about it, so why should we? That's their philosophy. Why should we have to get off our asses and do our job? Look how happy they are. They're happy just doing this. Being on dialysis. We as a community need to start holding these entities responsible for their complacency and their laziness and their lack of compassion. We are the patients. This illness affects us. And if we don't say anything about it, then nothing changes.